I moved to East Palo Alto. I organized with other women in the community who did not have access to jobs for one reason or another, many social reasons. And we started something called Lettuce Work, which was, again, a play on words. It worked, though. And the women grew salad mix in the greenhouses and sold it. We sold it in East Palo Alto, and the women went from very low self-esteem, very dysfunctional, very short-sighted in their lives just to survive, to taking great control over their lives. And it was a wonderful process. And I learned a lot, that's for sure, which is another story. And I thank you for bearing with me as I go through this history a little bit, but how I got to where I am, and it won't go on much longer. So I reached a point of where the women were going off and getting other jobs, and my philosophy in all my organizing has been finding out what people who don't have need and hooking it up, hooking those needs up with folks who do have. So that's kind of a very basic philosophy I have, I guess. So I shifted my thinking because, and you can all identify with this, I'm sure, that being a gardener and a grower, as I had always been and as we did in this community, I always loved the idea that the earth produces something that heals itself. The herbs, I'm sure you all agree that the herbs are truly magical, magic in real time. So I started pursuing the idea of how we could use herbs primarily as a way for people who have limited access to health care to be able to build on their knowledge already, because certainly most low-income people do have, in one way or another, connection with the idea of herbs, because many times that's all they have had in certain circumstances. So I pursued it by going to Christopher Hobbs. If any of you know Christopher, he's a licensed acupuncturist. He went to 5 branches, actually. Started Sakara, I think it is, the herb company, and he is a botanist as well as a licensed acupuncturist. And he gave a long class of Western medicine, so I was getting into that, started giving classes in the community of East Palo Alto around those things, and actually overlapped with lettuce work. And they said, well, the best way to go about it is to get licensed. So I went to Chinese medicine school and also fell in love with acupuncture. I thought, ooh, needles, I don't want to do that, I just want to do herbs. But then, of course, when I tried it and did it, I loved it and thought it was wonderful as well. So I did that with the idea, again, my purpose, and which brings me here today, is to be able to use holistic healthcare, and I use that term broadly with TCM being underneath that, as a very effective, cost-effective, and very self-empowering way for people with limited resources to take care of their health. So that was the premise behind which we started Urban Health, as how to go about integrating, building a model for how holistic healthcare can be integrated into community using community-based organizations. Now, as you may know, and as Deepa hasn't talked directly about, but I'm sure, but in the public health system in our country, local clinics, community clinics, set up their clinics and expect people to come to them. And they're more or less successful around that model, depending on how well they do it and how they work with the community and whatever. Our model is that it works best to start with the community-based organization, because the people who are in community-based organizations know what they want and what they need, and they are oftentimes very unique. But this is not a general concept in public health thinking, which isn't to say that individual people don't appreciate it, but that's not the theory behind it. And of course, in this country, TCM is, we think there's more of them because we have a false sense of that in California, particularly in the Bay Area, but holistic healthcare, and specifically TCM, across the country is not an active part of public health care. So that's been our goal, is to feel our way along with how to create a model of being able to, in a community, have people be able to take care of themselves better. And so in doing that, the way we have proceeded is that we started with I'm saying myself and the people on our board are people, several people from the community of East Palo Alto, leaders in the community of East Palo Alto. But the people who work with urban health are volunteer acupuncturists, primarily from ACTCM, because that's where my that's where I went to school, and right? Our football team always loses against you guys. Most of the people, but there are people who've heard about what we've done and have come and volunteered with us from a variety of other places, and Deepa was one of those, and she was a great addition. So we started with doing ear clinics at Free at Last, which is a community-based local recovery place, and I continue to do that in a variety of ways, doing ear acupuncture. We are working and have worked, this is over 4 years, with the Ravenswood Family Medical Clinic, which is a nonprofit clinic in the community. And on Saturday mornings we have a clinic from 8:30 to 12 that is open to everyone, and we get from usually 30 to 50 people on a Saturday. And we've worked with the homeless shelters, which draws people from East Palo Alto as well. Our focus is on East Palo Alto just because it's available to us, and it's a place to be able to develop our model, but we're not exclusive. People can come, and a lot of people come from other cities. In fact, a number of them from San Jose come to our clinic on Saturdays. So that's the overview. Thank you for bearing with me on that lengthy story. I'm happy to talk with you about how we set up those clinics and how we make them work and whatever. And so maybe what I'll do at this point is to shift the questions to you, and you can ask me anything, my shoe size or whatever. I'm open to whatever questions that you have in how we've done all this. So any questions about it?
So I'm just curious where you see this going. I can't get the history up
What
to
a
the point.
question. I have my master proposal that I finished yesterday. It's taken me 4 years to
No,
get
I
to
wasn't
this
paid to
stage.
ask you that.
Not yet. But just before we get to that question, maybe I can explain a little bit about how, if you were interested in setting up an ear clinic, and there are a variety of ways. I'm coming from the premise that all of you have an appreciation for the fact that we have received a great gift in the medicine that we're being taught, and that gift does bring responsibility, of course, to the patients that we see every day, and to ourselves to make a living. That is important as well. But it also means that the larger community, there are folks who cannot afford our services, and that we have some obligation to them as well. So I'm assuming that on some level you have that belief system. If you don't, then don't let me know that, or we can have a discussion about it, or it's fine. I'm not being critical, just kidding.
I'm curious how you get the word out to these communities that you're there.
Okay, well, as I've said, I have lived and worked in East Palo Alto, in the community of East Palo Alto, and community-based, helped set up a number of community-based organizations. City of East Palo Alto is only 2.5 square miles. But of course, the question you raise is exactly why I stress the importance of working with community-based organizations. Too many models, and thank you for that question, by far the dominant model of people wanting to do work with poor people is folks arriving on the scene and coming up with an idea about how they want to help people. And how can you join me in helping my idea? Well-intentioned, certainly, caring, compassionate, and whatever, but it doesn't work. first of all, most people who come in have had to raise resources to be able to do work, because it generally takes work. So the money goes to the people who are coming in, generally, and they rely on a volunteer basis for the people who are in the community, right?